Welcome this afternoon. I wanted to introduce our speaker today, Dr. Thomas Bader, who's going to share his expertise with us on COVID-19 and the vaccination. Dr. Bader is currently the Vice President of Medical Quality at Hackensack Meridian Health. Dr. Bader has also served as Clinical Associate Professor of Obstetrics and Gynecology at Temple University School of Medicine. And as well, he was the Chief of Medical Officer and attending physician at Crozer Keystone Health Systems. Dr. Bader did receive his bachelor's degree from Duke University, his MD from Georgetown University School of Medicine, his MGA from the University of Pennsylvania, and an MBA from the University of Massachusetts. Welcome, Dr. Bader.
Thanks very much, Pat. And can everyone hear me okay? Great. All right. Fantastic. All right. Well, thanks very much. And thank you for having me. I'm glad we get a chance to talk and hash out some of these important issues. And thanks all for your attention. And I also appreciate some of the questions that were raised. Pat briefed me on those before we got started. Obviously, we're at a critical point and really a historical time for us as a nation and for all of you as people who provide services to our community. We're dealing with just an extraordinary challenge. Obviously, the great news, the sort of miracle, frankly, of our situation is that we have first of all, we have the tools to deal with serious illness in general, but now since December, we've had the incredible, phenomenal gift, I guess, to have the availability of vaccine to fight this thing. And I know that's what the subject for our discussion today. And so I want to welcome as much discussion as possible. As Pat mentioned, I was trained as an OBGYN and, sort of grew up as an OBGYN, but for the last, probably for the last decade or so, I've served as chief medical officer and chief quality officer in a variety of different settings, and now working at Hackensack Meridian Health as a vice president for medical quality. And in that capacity, I've gotten exposed to, all sorts of different elements. I've been involved in discussions about procedures that didn't even exist when I was in medical school, but I've learned a lot about them. And, vaccination is one of those things. Obviously, it's something that you learn a lot about in medical school, but I was first exposed to it during the 2009-2010 H1N1 epidemic when I was my department's representative for our effort to quell that pandemic. Learned a lot about influenza vaccination at that time. And so I was able to step up when Hackensack Meridian needed a physician lead from the quality department to get involved in our vaccination efforts in battling this pandemic. And so I sort of stepped back into that role. And again, it's wonderful that we have that tool, but I think I'm really glad that we're going to have the opportunity today to talk about the many issues that go along with vaccination. So I think with that as a background, I'm happy to open it up to questions. And I guess, Pat, you're going to moderate.
I am actually going to go through, first of all, thank you everyone for submitting your great questions. And I will go through those questions. And then if you have any subsequent questions, you can put them in the chat room and we'll go from there. And just to let you know, we are recording the meeting so that if you need it for future reference, you'll have it as well. Great. Okay, so first question, is the vaccine safe if breastfeeding?
Sure, and again, I'm an OBGYN, so I'm very familiar with the safety of vaccination and breastfeeding. I think I would say pretty much every vaccine is safe, but certainly there's no doubt about the safety of this vaccine in breastfeeding. That was consensus reached early on that women who are breastfeeding, there really is zero risk to either the mom or the newborn with breastfeeding the vaccine, so absolutely.
Great. Is the vaccine safe during pregnancy?
So as many of you may be aware, there was some initial hesitation or maybe a range of different opinions. The WHO had one opinion, the CDC had a different opinion, the American College of OBGYN, which is probably the most influential organization, at least in the medical world when it comes to pregnancy, had their opinion, and the ASRM, the American Society for Reproductive Medicine, had their own opinion. And fortunately, I would say in the last several months and even the last, I guess, probably about 10 days ago, people seem to have come around to the consensus that the vaccine is safe in pregnancy. I do want to emphasize that one of our first thoughts when it comes to safety of vaccination and pregnancy is whether it's a live virus. And as all of you are probably aware by now, 2 of the vaccines don't contain any virus. And the third, the Johnson & Johnson vaccine, does contain a virus, but it's not a virus. First of all, it's not the COVID virus. It's a adenovirus vehicle. And secondly, it can't replicate. It's not a live virus in that sense. And so for all those considerations, the vaccine is considered to be safe in pregnancy. And again, because we know that unfortunately pregnant women suffer a disproportionate impact from the COVID disease, it's long been felt that it's recommended for pregnant women. And again, the CDC sort of finally came around and joined the ASRM in recommending it for pregnant women. I think that was about a week or 10 days ago. So long answer to a short question, but the bottom line is pregnant women should get the vaccine. Sorry.
Great, thank you. How long should someone wait after testing positive for the virus and exhibiting symptoms before they get the vaccine?
So you mentioned about exhibiting symptoms. So there should be essentially resolution of symptoms. In other words, people should be no longer have a fever and have clear improvement of their symptoms. And I would say for most people, that takes 10 to 14 days. There also is a little bit of a concern about coming into a site to get the vaccine when you're still potentially infectious. And so for all those reasons, it probably ends up being about 2 weeks after you get the vaccine. Importantly, and I think there's another question that comes up later on, importantly, we believe, we're confident, I guess I would say, that individuals who get COVID have native immunity, natural immunity for about 90 days. So there's no rush to get the vaccine. And so, if it took you 2 weeks, that's fine. But if you didn't get an appointment for 3 weeks or 4 weeks, that'll all be fine. Anytime within 90 days, it'd be fine to get the vaccine. But the bottom line is, after having disease where you're symptomatic, you should plan on getting vaccinated about 10 to 14 days after that, once your disease is really resolved.
Okay. Will the vaccine affect us in the future?
So, all vaccines are designed to provide some degree of long-term immunity. And really in that way, that's about the only way in which we believe the vaccine should affect us. I know we're going to talk a little bit about this later on about as far as the development, but the development of this vaccine, I really have to say it's almost like a scientific, a very targeted scientific development. It really is. I'm sort of blown away, even as somebody who's been involved in medical science for my entire career. I'm really impressed with the science behind this particular vaccine. What this vaccine basically does is, uses that little piece of mRNA, or in the case of the J&J vaccine, DNA, and tells our cells to make this particular viral protein, the spike protein, so that our bodies can develop an immune response to it. And that's so impressive to me because it's so targeted. We know what our bodies are going to do in response to this. They're going to make this little protein, and then they're going to target an immune response to it. So other than the creation of that virus, the creation of that protein, and then our body's response to that viral protein, which is an immune response, it shouldn't affect our bodies in any way. Now, again, throughout history, there's always been sometimes unintended consequences. But again, I want to emphasize the beauty of this particular technology is it's almost, we talk about surgical precision or, laser focused precision. I mean, that's the way this approach really strikes me, where we're just telling the body, just go and make an antibody to this. First, make this particular protein, the viral spike protein, and then make an antibody reaction to that particular protein. That's all we need you to do. And then, the vaccine can disappear. And so my expectation is there'll be no long-term effects of the vaccine, except we hope there'll be long-term immunity. And, I know there's a lot of uncertainty right now about how long that immunity will last. There's speculation about will we need boosters, maybe even boosters as early as this fall. That's all speculation at this point. The first person to get the vaccine got it in March of 2020. So the first person who got the vaccine has had it now for over a year. And so far we seem to be getting persistent immunity. But I basically, for myself, I've sort of resigned to the idea that we will need a booster, whether that booster is something that comes annually or every 2 or 3 years, like tetanus. We had a need for a measles booster a few years ago. So I don't know, nobody knows at this point what the pattern is going to be, but I would say most people are expecting the need for a booster, and just time will tell.
Great. That actually answered the next question. Will we need a vaccine annually? Do you foresee ill young children being eligible for the vaccine?
So as many of you are aware, I'm sort of in that between phase. My kids are old enough that they're eligible. I don't yet have grandkids, but I think all of us, one way or the other, we end up having to consider the issue about what to do with young children. So needless to say, there's a huge drive to get kids involved in vaccination for so many reasons. I mean, obviously for their own well-being, for schools, they're a huge part of the population. If we're trying to get to immunity for the population, we need to get kids involved. So right now, the drive is to lower the safe age group below 16. So right now, the Pfizer vaccine is approved for 16 and 17-year-olds. J&J and Moderna are only approved for 18 and up. So the work that's being done right now is on the 12 to 16-year-old age groups. Again, I'm an obstetrician, not a pediatrician. I don't know why that group is being chosen, but I do know there's different physiology and different dosage requirements at different ages. So right now the drive is to get the 12 or 16-year-olds, and the hope among the public health community is to get the 12 to 16-year-old age group, make them eligible by the fall. Now, obviously, we all know if they're eligible by, let's say, September 1st, we're not going to get them all vaccinated right away, but you can imagine a scenario where if we make if all the 12 to 16-year-olds, or 12 to 15-year-old really, because the 16-year-olds are already eligible, but if the 12 to 15-year-olds are eligible in September, maybe we'll be fortunate enough to get the vast majority of them at least vaccinated, maybe by into October. Now, obviously, that still leaves a huge number of school-age children out of the pool. But at this point, I would just say that's coming later in the year. So I think probably an optimistic view would be to say that perhaps we'll have. Then I think the next group they're looking at is either 5 to 11 or 6 to 11, and I think maybe an optimistic view is that maybe we'll have that ready by the first of the year in 2022. The one thing I do want to emphasize, and this is sort of a theme of this, is again, due to this new vaccine technology, we probably have greater confidence in the safety of the vaccine, at least again, on a theoretical standpoint. We obviously don't have the years of experience yet, but I think there's a very good reason to suspect that the vaccine will be both safe in children and also effective in children. But again, until it's proven, speculation is all well and good, but I think we can be optimistic about the likelihood of this vaccine being able to be extended to our younger populations in the months or perhaps year to come.
Great. Do you think the COVID and flu vaccine will be combined?
That is way, way above my pay grade. That's really sort of a public health decision. The United States FDA is in general reluctant to combine medications in general, and particularly it's unusual for them to combine vaccines. But as many of you know, it does happen. There's the MMR, which is measles, mumps, and rubella. There's DVT, which is diphtheria, pertussis, and tetanus. So they do decide to do that periodically. It might make sense. I could maybe see it happening. If it's going to happen, it's probably more likely to happen in 22 than in 21. I think, as probably many of you feel. A lot of people feel like, gosh, if we could just get through 21 and get everybody their COVID vaccine, and this fall get everyone their new flu vaccine, that'd be enough of a challenge. The idea that we would also be able to get them combined, that's probably a little bit too much to hope for. So I would say the short answer is they're not going to be combined. The longer answer is it wouldn't surprise me if in the fall of 2022, or maybe even more likely, maybe the fall of 2023, if we don't end up with a combined vaccine.
Okay, are masks a forever thing?
Great question, and very timely, even though I know the question was written before today. As many of you may be aware, the CDC just modified their recommendations for people when they're outdoors, particularly vaccinated people when they're outdoors. And so I think, the short answer is no, vaccines are not, vaccines are a forever thing. Masks are probably not a forever thing. It really does appear that already, the CDC has modified their recommendations as far as masks outside, and particularly for those of us who have been vaccinated, even masks indoors is something that we can begin to relax. As many of you may be aware, the CDC already says that if you're with just one other household and you've all been vaccinated, then it's okay for you to be indoors with masks off, as long as you, maintain all the other precautions about, obviously, if you have any symptoms and, maintaining reasonable social distance and all that. And even at Hackensack Meridian Health, I mostly work with doctors and nurses. We're on the honor system. I mean, I have no idea of knowing exactly whether or not people have been vaccinated, but people, state they've been vaccinated. And so when we're in a room, as long as we're 6 feet apart, we don't wear masks all the time. And some people choose to wear masks, which is fine. I am generally a mask wearer, although since I'm alone right now, I'm not wearing a mask. So we have started to loosen the restrictions again, based on science and relying extremely, relying to a great extent on our vaccination status. We are beginning to relax masks even inside, but certainly out of doors, particularly with the CDC's recommendations today. There's definitely an easing up on masks. Now, I can tell you, I could see a circumstance where if I go to a Jets game, I might wear a mask. I mean, it's the season, it's the fall, it's, the beginning of flu season. COVID's probably still going to be kicking around. I don't know. I could see going to a football game wearing a mask. I could certainly see going to a Knicks game where I'm indoors and wearing a mask. I could see wearing a mask on planes. As many of you know, that's in some societies, some cultures, that was already a common thing. I could easily see that becoming something that many people choose to do. I doubt, just it's not the American way for us to require things. And so I feel like my hope is that with enough vaccination and with weather improving and all that, the community rates of disease will just continue to drop. And so my guess is that a lot of these restrictions will be lifted, but I could see people continue to wear masks. And I could easily see it. Frankly, I have to tell you, it was wonderful to go through an entire winter and never get a cold. I would wear a mask just for that. But the fact I might also protect myself from other more serious diseases, there's a lot to be said for masks. But bottom line is, yes, the mask requirements are certainly going to diminish over time and already have as of today.
Okay. What is the difference between an emergency authorization and an approved FDA vaccine?
So it's really just a question of degree. So as all of you know, obviously the world's society was consumed by the novel coronavirus, the COVID virus, and therefore the FDA issued, when there was adequate data, there were about 80,000 people who received either Moderna or Pfizer in the trials that began in March of 2020. And so once the FDA had sufficient data, they said, look, this is a not just a public health threat, but also an individual threat. People's lives are in danger. We need to I don't want to say lower our standards, but we need to take action more quickly than we usually do. And so there's a fairly long process for the approval of medications in this country. Many of you may or may not know this, but the European Union tends to approve new medications more quickly than the FDA. The FDA is relatively conservative. But when the situation demands it, and I certainly think that the COVID pandemic demanded it, the FDA is willing to issue an emergency use authorization. And what that, the name of it says it all. It's an emergent authorization to use the medication based on the FDA's judgment that the disease that is being treated is so dangerous and really life-threatening that it's reasonable to have a shorter approval process. And so the FDA issued an EUA, an emergency use authorization, for all 3 vaccines, while the ongoing FDA review process was continuing. And so the FDA fully intends to issue a regular authorization for all these medications eventually. But what they said was, first of all, the medication appears to be, remarkably safe and unbelievably effective. I never imagined we'd be able to get 95% effective vaccines in the first year. But also the disease is killing people by literally by thousands a day. And so let's authorize the use of this medication now, even while we continue our process. And I don't want to, delve too much into the whole J&J situation, but that's an example where the FDA continued its surveillance of the vaccines and detected this this information, where there were 6 cases of a severe blood clotting situation, and that caused them to issue the 2-week pause, do the full review, and then eventually restart the vaccination with J&J. So that's an example of where the EUA is issued, but at the same time, the surveillance and the work on the vaccine or the work on the medication continued to allow the FDA to make eventually to make a sort of regular authorization. So I hope that clears up that distinction.
Great.
But I do want to emphasize the EUA was based on a review of extensive, it sounds so awful to say human data, but extensive data, of this medication used in humans. Again, about 80,000 people had received one of the 2 mRNA vaccines before that was approved, and about 30,000 people had received the J&J vaccine before that received its EUA.
Okay. Will ID cards be a forever form of ID that we'll have to carry?
So I can tell you my best guess. Obviously, I'm not a sociologist, but I would say that ship has sailed, and we are unlikely to have the ID cards, the passports. I think for very good reason, our focus was on getting people vaccinated and not on having the best system for tracking who has a vaccine and who doesn't. If you want to prove that you have a license to drive a car or fly an airplane, we're very careful about making sure what people get. Look at that card that you were issued when you got your vaccine. It's not the most impressive document in the world. And I think, again, we made the decision to very quickly get the vaccine out. We don't have a great way of tracking that. Also, I would just say again, as a culture and as a society, we celebrate individuality. We recognize that some people have medical reasons why they perhaps aren't able to get the vaccine because of prior severe reaction to a vaccine. I mean, that's about the only indication when you can't get the vaccine. But so there's recognition of that. I think there's privacy issues. My guess is that's not where we're going to end up. Now, maybe in a few years when things settle down, maybe the government will decide this is something that they want to do. But I would say it's unlikely that we're going to end up in a circumstance where people are always going to have these cards and be asked to prove it. Now, I know there are certain individual private companies that have said, the only one I'm really aware of is I think there's some baseball teams that said they're going to set up special sections for people who are vaccinated. I know there are cruise lines that say you have to prove vaccination before you can get on, but I think in general, that's probably not where we're going to end up. And the other thing about it is, America, I think the pandemic is likely to get better. And as it gets better, we're going to take our eye off the ball. They're going to be a lot less focused on, considerations like this. And we're going to move on to other things. And even though it might not be a bad idea to encourage people to get vaccinated by giving them special access, I just don't see us ending up there. But, time will tell. Okay.
If a person refuses to get vaccinated, will there be any limitations for school, work, travel, etc.?
So I think that's a moving target. The short answer is absolutely. Already there are many universities that will not allow you to attend without vaccination. Now, interestingly, most of them have not taken the step of requiring it of their employees, although I would say that's probably next. But certainly, you can't attend Rutgers unless you're vaccinated, just to give an example. And Rutgers is not going to be the only place that's going to take that. So, again, totally different order of magnitude, but cruise lines may not let you get on. There are airlines who have indicated you're going to need to be vaccinated or at least get tested. So I think, yes, there are going to be restrictions on people who don't get vaccinated. Time will tell how extensive those are and how tightly they're enforced. But yes, there are going to be restrictions.
Okay. Can fully vaccinated people transmit the virus?
So unfortunately, the answer is yes. Now, sometimes these numbers can be kind of daunting, but it is important to remember that, even, again, most vaccines are not 95% effective, but I know that's probably something we don't like to acknowledge when we're getting vaccinated, whether it's the flu or HPV, MMR, whatever vaccine you're getting, but they don't usually work 95% effective. So having a vaccine that's 95% effective, or for J&J, the initial study was 75% effective. Those are really terrific vaccines. But obviously, even terrific vaccines, even a vaccine that's 95% effective, means that it's 19 out of 20 people who would have gotten the disease don't get it, but that one person does. So there are a small number of people. Again, we're talking about a nation of 330 million people where guess at this point, over 100 million of them have been vaccinated. But there are people who have had overt disease. There are people who have been hospitalized with COVID after they've gotten the vaccines. So it does happen. So if there are people that are getting the disease and being hospitalized with the disease, there are certainly people who have a low grade disease and are still likely infectious with the virus. Now, the great news is it appears that is a very unusual phenomenon. In other words, the vast majority of people who are vaccinated are not able to transmit the virus, which is fantastic news. That, in other words, not only when you are vaccinated or if I'm vaccinated, not only am I protecting myself, but it appears that I am protecting others around me, loved ones that I'm with, my 88-year-old mother. She's vaccinated, but I still want to protect her from the virus. But even, obviously people, patients in the hospital that I see, people that you're going to encounter on public transportation, you're protecting those people by being vaccinated as well. And so the short answer to your question is technically, yes, you can transmit the virus despite vaccination, but the chances of you being a transmitter are drastically decreased. Even if you do get COVID, you probably don't get it to the point where you're a very efficient transmitter of the virus.
Okay. Can you talk to us about what we can say to our families that we're serving, people that we're talking to in terms of their reluctance to get vaccinated, and what talking points you would suggest?
So I think this is an easy one. Again, as I mentioned before, in my career, I've had to counsel people, pregnant people, non-pregnant people, about lots of vaccines. And I think vaccination in general it's a good idea. The reason we have vaccines is they're safe and effective, and they prevent a disease. It's important. But you think about some of the other diseases that we have vaccinated people against to try and protect them. Again, not to minimize, measles is a serious disease, mumps is a serious disease, tetanus is a potential killer, but those are not very common diseases, partly thanks to vaccines. I think about all the people that I had conversations with about the human papillomavirus vaccine. There are some cancers that, cervical cancer and head and neck cancers that do come from HPV vaccines. But again, it's an uncommon reason for folks to die. Here you have a disease that is an incredible killer. It's about 20 times as deadly as the flu. And I think, again, it was pretty easy to make the case for people to get the influenza vaccine. Here's a disease that's 20 times as deadly as influenza. So I think in terms of the severity of the disease we're preventing, this is an extraordinarily serious disease. Obviously, a disease that's so deadly that it's already killed almost 600,000 Americans. It's killed millions of people worldwide. And then in addition, it's incredibly effective. Again, as I said, 95% effective is really remarkable, and it seems to be extraordinarily safe. And so, to me, it's a very easy argument to make. I think, as you can tell from what I've said today. Very serious disease, very effective vaccine that seems to be very safe. The only downside of the vaccine is, as all of you have experienced, is it's a little uncomfortable. The shoulder hurts a little bit, and then you don't feel great the next day. But other than that, it's a very to me, it's a very easy argument to make. And again, it's tragic to me to think about all the people. And again, as you all know, it's tens of millions of people who have decided to forego vaccination. Let's face it, some of those tens of millions will die because of that decision. And this is a vaccine against something that's preventable death. I wish I could get a vaccine against heart disease, or a vaccine against cancer, or a vaccine against stroke. I can't get a vaccine against any of those diseases. They're preventable. Only lifestyle choices and medications might make them more preventable, but they're generally not preventable. And unfortunately, one of them will probably get me someday. But COVID's not going to get me. It could have gotten me. It could have killed me. And unfortunately, as I said, some of those tens of millions of people who forego the vaccine will die from a disease that's completely preventable, or about more than 90% preventable with vaccination. It's a missed opportunity. I guess that's probably my biggest summation. It's a missed opportunity. If you don't want to.
Some of the hesitancy that we're hearing from people is that the vaccine's too new. They want to wait and see kind of more about it, as it's being administered and what kinds of things
Great.
present?
So a couple of points on that. So the first one is, it's new in the sense that this is the first time that we have used this particular technology, but the technology itself has been around for about 2 decades. It really was a circumstance where the use of mRNA as a technology, and I do want to say the J&J vaccine relies on a more a technology that's already been used before, where you use a vector virus, a deactivated vector virus to transport DNA. That's a more established technology. But even the new mRNA vaccination relies on technology that's really been developed for about 20 years. It was sort of waiting for its moment, and its moment arrived. And as I said, it was a circumstance where the technology was so well developed that even though coronavirus was only identified in December of 2019, they actually had the Moderna and Pfizer vaccines were actually ready to go. The product that we are vaccinating people with today was ready to go, ready for human trials in March of 2020, just 3 months after the virus itself was identified. So it's kind of established technology that had never been used before for vaccination. The other thing I would say is, again, back in December, when we gave those first shots, we were relying on the experience of 80,000 people. About 80,000 people had received the Pfizer or Moderna vaccine. So I can certainly understand people saying, whoa, 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 what are you doing? What is this stuff? But, in the last few months, we've gone from 80,000 to over 100 million. And so our knowledge of this vaccine has expanded dramatically. One of the reasons that the issue about the J&J concern with clots came up was we went from about 30,000 people to tens of millions of people getting the vaccine, and so we did detect this rare but very serious complication. So I would say to people who say this is new technology, yes, it was new technology in December, but it was based on 20 years of research, and I would say frankly at this point it's not new technology anymore because we've had 100 million people's experience with it in the United States.
Okay. How about if someone is saying to us, well, I've had COVID, so I don't really need the vaccine?
So we've already seen people, it's unusual, but we've already seen people who have gotten COVID after getting COVID. And there are people who get, their second round could be quite significant. And so I would say, obviously it's one, thank God if you did get COVID the first time, you're one of the 98% that survives COVID, because about 2% of people who get COVID die. But if you want to avoid getting it ever again, you will dramatically reduce your likelihood of getting COVID by getting the vaccine. And so, again, I know that many people do go through COVID and they manage okay. Thankfully, most people don't end up in the hospital. Most people don't need to go to an intensive care unit or have be on a ventilator. But it's still, obviously, it's a very serious disease. And if you want to avoid getting it again, you should get the vaccine, because unfortunately people could get COVID a second time.
Okay. There were a couple of questions here about children that are under the age of 5 who have not had COVID. Is it safe to travel with them? Would they have long-term side effects if they had COVID?
Yeah. So obviously, at this point, even though we're about 15 months or 16 months into the pandemic, so we don't have long-term knowledge. It does seem to be a serious, there's the potential for long-term, consequences or sequelae from the infection. So I would say it's probably imprudent to say, well, it could happen to adults, but it can't happen to children. I mean, if adults can get long-term sequelae, children can probably get long-term sequelae. In terms of, how to deal with 5-year-olds who obviously can't get the vaccine and won't be able to get the vaccine probably for close to a year. I think the first one is I would definitely partner with your pediatrician. The second one is, though, one of the things we've learned, and you all recall from last spring when we were cleaning, groceries, we've learned a lot about the virus. And one of the things we've learned is that it's overwhelmingly an aerosol disease. It doesn't seem to be a surface disease. It's something that seems to be overwhelmingly carried in the air. And we know how to protect each other from aerosols. And they are, wear masks, maintain social distancing from people that are outside your household, stay in well-ventilated areas to the extent possible, wash hands frequently. If you need to cough or sneeze into your mask, and then change your mask as quickly as you can. Or if you're not wearing a mask, cough or sneeze into your elbow, not onto your hand. And so I think with all those precautions and extending those as appropriate to 5-year-olds and below, we'll probably be okay. I mean, one of the things that's kind of impressive to me is how relatively few outbreaks we had in schools. And I think what that speaks to is that I know many schools didn't open, but the schools that did open, and what it shows is that the kind of prudent precautions that everybody was urging seem to be pretty effective. The other thing about 5-year-olds is, and small children in general, is they have 5-year-old size heads and 5-year-old size oropharynxes, and they just don't seem to be very efficient at spreading the virus. So that seems to be another benefit.
Okay. What about people that are reluctant to get the vaccine due to underlying medical conditions?
So that's, frankly, I would almost say, you can almost cut that sentence in short. What about people that are reluctant to get the vaccine in general? I mean, I would say having a chronic medical condition would make me even more apt to want to get the vaccine. Again, the vaccine appears to be safe for virtually everyone. I mean, except for people who have had a severe allergic reaction to a prior vaccine or injectable medication, or people that are allergic to a component of the vaccine. So I would say everybody should get the vaccine, particularly people with chronic medical conditions, because people with chronic medical conditions sometimes will have some compromise to their immune system. They might be more susceptible to the ravages of COVID. And so, frankly, I would say I'm enthusiastic about the vaccine for healthy people, but for people with chronic conditions, I would be even more enthusiastic in my recommendation that they get vaccinated.
Okay. Can you tell us what precautions we should take as we return to meeting with our families outside? We're going to start doing that, moving towards
Great.
people outdoors.
So I think, probably the first two things I would say are, getting vaccinated and being outdoors. Right off the bat, you are giving yourself a huge advantage in terms of preventing infection. Another certain step is maintaining that 6 feet of separation. Another one that would apply indoors or out is obviously if you are ill, if you have respiratory symptoms, coughing, sneezing, sore throat, fever, shortness of breath, any of those symptoms, you want to obviously not come to work. And similarly for your clients, the people you're serving, making sure that they're free of symptoms. That's prudent. Masks, as I mentioned, masks out of doors, we're starting to soften that message, but certainly a mask can't hurt, particularly if you're meeting with somebody from, outside your household. If you don't know what their vaccination status is, I would certainly wear a mask under those circumstances. Barriers, anything that prevents, direct flow of air and particles and aerosols between you and another person would be, another aid, although obviously that's not always necessary. So again, vaccination outdoors, 6 feet, masks where appropriate, wash hands before and after, even though, you think you're not going to have contact, but obviously contact sometimes happens. So all those steps would really put you in very good shape.
Okay. Suggestions as to what to say to people who are telling us the vaccine is a government experiment.
So I would say, I have no way of knowing definitively. I don't want to say I trust the government, but I think the overwhelming bulk of the evidence is that this was a very cleanly, appropriately done study. I have to say, probably one of the things that if you were thinking along those lines, probably one of the things that would give me the most comfort is the fact that we've actually changed administrations during the vaccine. I sort of feel like if Trump, any of the Trump representatives, I don't mean President Trump specifically, but if any of the people who were there then could come out now with a book or a magazine or a Fox News appearance and blow the lid off the government experiment, this would be the perfect time to do it. I think similarly, if anyone from the Biden administration arrived in DC or Atlanta, where the CDC is housed, and found out that, oh my gosh, they didn't do this properly, they would have blown the lid on it, partly because it's the right thing to do, but partly they would have loved to have embarrassed the previous administration. So I think there's very little that I think you can put behind such a concern, but I would say, frankly, the fact that we had a transition of administrations is one of the things that makes me, I guess, about 99.9999% certain that it's not an experiment. It was just a purely straight study done by two legitimate companies, Pfizer and Moderna, cooperating with public servants that are trying to work for public health.
Okay. What about people who feel that the Johnson & Johnson is an inferior vaccine compared to Moderna and Pfizer?
So I think there's probably, I would seriously discount the concern around the recent concern about the blood clots just because they're so rare. And it wouldn't shock me if we when we look back, we'll probably find a few rare conditions associated with medications. When you give a medication to 100 million people, unfortunately, some things are going to happen. But I think the concern about the effectiveness, 95% is obviously higher than 75%. One of the points that was made was that the Pfizer and Moderna vaccines were tested before some of these variants came out. And one of the beliefs about why the Pfizer and Moderna vaccines may have a somewhat higher effectiveness is they may have been tested overwhelmingly at a time when the variants weren't as prevalent, whereas the J&J vaccine was tested both in a geography and at a time when there were more variants. But the bottom line is, I would say, and my son got the J&J vaccine. I'm a big fan of the J&J vaccine. One of the biggest thing I would say is if you have a chance to get a vaccine against a potentially deadly illness, and someone tells you it is 75% effective, take that vaccine in a heartbeat. And that's basically what I told my son. I wouldn't hesitate. So, would I rather have 95% effective than 75? I guess. Would I rather have 99 than 95? I guess. But really what I want an effective vaccine that's available to me today. And if the J&J vaccine is available to somebody, I would say, yes, there are concerns. Yes, there were 6 cases out of over 8 million. But this seems to be an overwhelmingly safe vaccine that is a very effective vaccine. Again, 75% is very effective for a vaccination. And it's available to you today, and it seems to prevent a potentially deadly illness. Take the vaccine. That's what I told Jack, and that's what I would tell anybody else.
Okay. How about discussing vaccination with teens and young adults who perhaps came from a household that was an anti-vaccine household?
Yeah, that's tough. I mean, as all of you know, now that I've gone through my 4th teenager, teens are tough. They're tough talking to them about substances, tobacco, sex, you name it. It's just the nature of their brains. Their brains aren't mature, and they think they are immortal, and they can drive fast on the highway and take drugs and have sex, unprotected sex, and on and on and on and on. So I know it's tough to get to their heads. I think. Honestly, giving them the facts is always helpful. Respecting them, treating them like you respect them, and you want to give them information. You don't want to just scare them. But I think it is worthwhile to say, they don't want to be in the hospital. They don't want to have, they don't want to lose taste and smell. They all love fast food and candy and God knows what else, junk food. They don't want to lose. It would be awful if they couldn't taste Doritos anymore. So maybe that's a hook. Whatever you can do, I guess, to tell them. And the other thing is to tell them, they're young. They're gonna do fine with the vaccine. Obviously it's a challenge, but I would just emphasize to them that even young kids can be hospitalized. Unfortunately, young people die. I mean, that tragic circumstance, she didn't die, but a tragic circumstance of that 26-year-old or something in Chicago needed to have her lungs transplanted. And I mean, things like that. So it's not something to be taken lightly. They'll do well with the vaccine. It's certainly safe in young people, just like it's safe in older people, and they should respect this disease because again, unfortunately, it can do terrible things to them, hospitalize them, and unfortunately, even in the rare cases, kill people.
If anyone else has questions, can you please add them to the chat? And we're just looking over the list that we currently have to see if we covered everything.
Yeah.
Oh, birth control.
Does it interfere
with the vaccine? Does it interfere with birth control?
No impact on birth control whatsoever. No method of birth control would be impacted by this. I know there was also a question about infertility. I don't know if I don't think we got to that one, but I don't know where that came from because I've never heard of any concerns about vaccines having an impact on infertility before. But I think that has been, as said, really debunked. As I mentioned before, the ASRM, which is the American Society for Reproductive Medicine, that is the team of health professionals that are involved in treating women and men, but women in particular, for infertility. They emphasize that people that were undergoing evaluation or treatment for infertility, people that were undergoing in vitro fertilization, they should all get the vaccine. They said if you get your first vaccine and you become pregnant while you're waiting for your second vaccine, get the second vaccine. So I really think I don't really have no idea what the basis for that was. And again, I've never heard in my entire career as an OBGYN, I've never heard of any concern about infertility and vaccines before. And I have no idea how it glommed onto this one. But again, there was no basis for that. It's never been borne out. And so at this point, I would say there's no concern about that.
Will the immunity from the vaccine carry over to, so if a mom is pregnant, will that immunity carry over to the child?
That's a great question. So as many of you may be aware, pregnant women, there is transfer of antibodies from pregnant women to their unborn child via the placenta. And so babies are born with some degree of passive immunity. And that has been demonstrated in cord blood of moms who have either had COVID or had the vaccine, that they do transfer passive immunity that way. That passive immunity doesn't last very long. Once the antibodies break down, then the baby no longer has immunity. There also is, for other conditions, there can be passive transmission of immunity via antibodies through breast milk. And I have not seen, I know there are antibodies in the breast milk, but I've not seen any evidence yet as to whether that's adequate to prevent infection. So I would say the short answer is it's very likely that via the placenta, there's some degree of passive immunity for a newborn. And for mothers who breastfeed, there's likely also to be some degree of immunity. But I would say right now, at least, it's not clear that it's protective immunity for a newborn.
Okay. We had a question about, I'm just trying to find it here. Okay. Is there any risk for someone who getting the vaccine, for someone who had multiple surgeries, brain surgeries to remove tumors?
Yeah, I saw that. And there was also another question about the thyroid disease. Again, I would say previous history of surgery, previous history of a serious illness, previous history of an ongoing chronic illness. None of those things would be in any way a contraindication to vaccination. And again, I would argue for some chronic illnesses, chronic heart disease, chronic lung disease, I would say that your history of a chronic illness would actually make you an even stronger candidate for vaccination because of the potential for devastating lung injury from COVID. So if you already had an ongoing health compromise, you wouldn't want to get a second health compromise from COVID. So I would say it really is kind of, we make up this questionnaire, do you have a bleeding disorder? Have you had COVID in the last couple of weeks? But it's almost like no matter what the answer to any of your questions is, we always say, go ahead and get vaccinated, because it's fantastic that the vaccine seems to be tolerated so well by so many people. And obviously it offers you the protection against a deadly disease. So really, no matter what your health history is, unless it's an allergy to the vaccine itself, the answer is almost just get the vaccine.
Okay. Is the immunity from the vaccine different from the immunity from actually having COVID?
Yeah, so sometimes people refer to so-called natural immunity, and I know in the case of chickenpox, so that's another vaccine I forgot about. Now we have chickenpox vaccine, but in the case of chickenpox, there was some concerns like, no, I don't want my kid to get vaccinated immunity. I'd rather have them get natural immunity, and so people are gonna have chickenpox parties or whatever. So there is a difference, and the biggest difference, I guess, to put it most simply, is that when you get the vaccine, your body ends up making the viral spike protein and then having an immune response to the viral spike protein. If you are infected with the actual virus, you are exposed not just to the viral spike protein, but to many other proteins that the virus carries. And so therefore your body has the opportunity to have an immune response to those other proteins. But I would say, unfortunately, by getting the disease, you also run the risk of death or serious illness, hospitalization, long-term consequences, et cetera. Whereas when you get that vaccine, you're spared all of those. And again, over time, if you took 100 or 1,000 people who were immune because of the vaccine and 1,000 people who are immune because of having gotten the disease, I'm not sure that they'd behave a whole lot different over the long term. The immunity of the vaccine seems to be good enough to prevent the disease, just like immunity from getting the disease seems to be largely effective at preventing recurrence of the disease. So there is a difference, but I would say first of all, it's not clear there's any benefit to the difference. But secondly, I would say one is overwhelmingly safe and well tolerated, and the other one carries a 2% risk of death.
Okay. How to discuss concerns about foreign DNA or RNA being introduced into the body?
Well, I guess, that's a tough one. And I think it is hard to kind of get your head wrapped around it. We are exposed to, DNA and RNA and, non-self proteins all the time. We have robust immune systems that deal with those substances. Not to gross people out, but our bodies are teeming with foreign bacteria. That's a natural part of our bodies. I guess the good news about both the mRNA and the DNA the mRNA and the DNA that we are exposed to is that it's only there for a short period of time. It is broken down by our bodies. It disappears. It's not incorporated into our DNA. It doesn't. None of these things even get into our egg or sperm cells, so they're not, in our bodies that we're passing on to our children. And so, I guess I would say the first one I would say is, it is normal for us to be exposed to foreign proteins and foreign viruses and foreign bacteria. Every single day that we go about our lives, we are exposed to those proteins and some measure of mRNA or DNA. Again, we're not typically incorporating it into our cells, but it's there when we're exposed to viruses. The viruses put their RNA or DNA segments into our cells. So our bodies are really designed to be exposed to this. This is a circumstance where we're harnessing that phenomenon to our benefit, as opposed to most of the time we are being exposed to bacterial and viral proteins and DNA and RNA because those substances are trying to infect us. So this is a different circumstance. But I admit there's no way of getting around it. It's kind of freaky to think about, being exposed to these foreign substances. But honestly, that's the way our bodies are designed, and this is a circumstance where we're taking advantage of that design.
Okay. If you're within 90 days of having had the COVID illness, are you able to follow the guidelines for vaccinated individuals?
That's a good question. I think the unofficial answer is yes. I would say the official answer is I don't know. They actually give that kind of advice, but I would say that's probably a reasonable approach. Is to say, if I had COVID, was diagnosed with COVID within the last 90 days, then I should have all the protection that somebody who's been vaccinated has, and therefore I can take the same steps that a vaccinated individual could take, whether that's being outdoors and not wearing a mask, or meeting with somebody inside and maintaining distance without mask. So I guess I would say, those are roughly equivalent. I've never seen that from the CDC, but it makes perfect sense.
How long does immunity or antibodies, how long does it last?
So just a quick mention about antibodies. So your body makes antibodies during the acute infection, and then those antibodies counts tend to drift down over time. The important thing about our immune system is we have memory. Our immune system has memory. As you may have read, there's helper cells and B cells and T cells and natural killer cells. There's all different cells that make up our immune system, and our immune system is more than just antibodies. And so antibodies persist for weeks. And then after that, frequently the counts go down to very low numbers, and that's okay. That's normal. Now, that's not to say you might not still have some antibody counts, but your antibody counts are going to drop significantly. And again, we'll eventually figure out how the COVID vaccines work and how natural COVID infection works in terms of how long the antibodies persist. But the real question is, how long does immunity last? Because we don't really care whether we have antibodies around. What we really care about is, are we immune? And as we discussed earlier, we are reasonably confident that the immunity that we get from either the COVID disease or from COVID vaccination will not be a lifetime immunity. We expect that there's going to be boosters, maybe boosters. I doubt as early as this fall, but I know there's discussion about boosters as early as 2022. So right now we don't know exactly how long it lasts. The good news is it lasts a good long while. Maybe up to a year, maybe 2 years. And again, just like with the influenza vaccine, if somebody told me, well, every year you're going to have to get a booster against COVID, I would say, great, sign me up. And as we touched on before, maybe eventually those two would be combined. So the antibodies last a little while. Immunity lasts long enough. Right now, at least a year.
Okay, I'm going to pull in your ENT skills and ask you, some people who still do not have taste or smell, other than the difference between salty and sweet after recovering from COVID about 2 months ago, is there any way to help get taste and or smell back after having COVID? And is it possible, hold on, I have to scroll. Is it possible for someone to permanently lose their taste and smell from COVID? And what other effects seem to be most persistent even after recovering from the virus? Ooh,
okay.
That's a long one. Okay.
Yep. All right. So, nobody knows how long the loss of taste and smell lasts. There's certainly people who were infected in China in December of 2019 who probably still don't have their taste and smell. So, at this point, what is that, 17 months, 16 months? That's as long as we know. Most people do get taste and smell back. As somebody pointed out, or you touched on, it might be partial. There's some what's called plasticity or remolding of the nervous system associated with taste and smell. I'm not aware of any treatments, and it probably is too early for there to be much data on treatments for people who appear to have not had a return of their taste and smell. I'm sure, unfortunately, there will be enough people that will have that condition that there'll probably be some trials is there also a question about prolonged symptoms? There are a variety of prolonged symptoms, fatigue, difficulty breathing, muscle aches, things like that seem to persist in the so-called, I think they're sometimes called COVID long haulers. So that's definitely a phenomenon that exists.
Okay, well, we're rounding the bend to 3 o'clock. We want to thank you for all of your time and all of your expertise today. We've gotten a lot of our questions, all of our questions answered today by you. Thank you so much.
Great. My pleasure. Honestly, it's nice talking with you, meeting with you, hearing your questions, and I appreciate what you do for your customers and your clients. And I also appreciate you all getting vaccinated. It's all part of our effort to beat this pandemic. And again, for those folks you deal with who are reluctant, just tell them. To me, it's, as you can tell, I think it's a really straightforward decision. They have a choice between a very safe, very effective vaccine versus a potentially deadly illness. So, thanks everyone. Have a great afternoon, and I hope you all stay well and healthy.
Thank you.
Thank you.
Take care. Bye-bye.
Bye now.